So over by Calabash Bay here would be our main beach where would be a lot of activity. You would have the people who sell the fresh fruits and vegetable. And they used to have the people coming from the mountain on their donkeys. Yeah, and they would bring all the fresh fruits and vegetable down. And then you have the fisherman, and the wife of the fisherman would buy those fruits and vegetable and meat from them. And then those donkey people would have take the fish back up into the hills and sell it house to house, pound by pound. So it was always an exchange between the fishers and the farmers. Yeah. And then on the other side you have Great Bay. Frenchman is on the other side, and then Billy's Bay. So Treasure Beach is made up from 4 fishing beaches. And as I said, it was all about fishing here. Unfortunately, our fishing have declined. There's not a lot of fish anymore. It's what we used to have. So the fishermen that we have here now, it's less fishers and more fishermen going further out at sea to spend more time out there and still catching less fish.
So a lot of people, the difficulty of getting to a hospital is great. It's half an hour to the nearest hospital, and that hospital quite often has a very long wait at the emergency room. And the other issue, a lot of people don't have vehicles here. So that means if you're sick or injured, you have to wait on the side of the road for a taxi to come by, flag the taxi down. Then the taxi doesn't take you directly to the hospital. You have to make stops along the way to let people off, pick people up, and so on. So it's difficult to get to the hospital. Once you're at the hospital, it can be a long wait. And quite often they don't have a doctor on hand. You have to wait for the doctor to come in. It's not easy. It's not easy at all. And especially if it's urgent care needed, it's almost impossible to get urgent care around here.
I first came to Treasure Beach in 1998 with my now husband, and we fell in love with the place like most people do. And we got to know some of the women in the local Treasure Beach Women's Group, and we did a few projects with them, became friends, and we kept going back. And a few years later, Hurricane Ivan hit. That was in 2004, and it completely devastated the community. And there was a page put up about things that we could help to get the community back on its feet, things we could help with. And one of those things was a picture of the Women's Group building. It was a very small building, sort of like a, almost a storage container, one of those, container things that people make houses out of. And it was destroyed. It was on its side on the ground. And I remember looking at that and thinking, we could build a building. We could build a real building. A lot of excitement built around that, and a lot of folks in the community started to get involved. The Peace Corps wrote some grants. Other people donated money and supplies, and within a week, we had the foundation and the walls of the building up. And at the time, I thought we should put in exam rooms, and I didn't know really why. It just seemed as if there was no medical presence in the community, and I thought maybe we could have some doctors and nurses come down at some point.
So we started having health clinics just in our community, and with doctors from the Hillsborough County Osteopathic Society of Florida. And they bring the doctors, the nurses, the assistants, and the medical students, and we all come together and work together to see to the medical needs of our community.
So my name is Karif James. These are my parents, Sadie and Sylvan James.
For 15 years, Karif has been walking with this horrific limp. He was qualifying for a professional cricket team, had a very high intensity fall, and it's so unfortunate that in Jamaica he couldn't get medical services, surgical services, or expertise. Karif, although he had this horrific limp, he still did everything he could in his power to help us and assist us on this medical mission. With every patient that we stopped at, every house we stopped at, he got himself out of the driver's seat, went and opened gates, even though he had this horrific limp. And it was that passion that I saw in him, that compassion to help everyone, that drew on my heart to bring this gentleman to Fort Worth.
So he'd had a broken femoral head, which is the ball part of the ball and socket joint of the hip. A portion of the ball had remained inside of his hip and it moved around and caused a pretty significant amount of arthritis. As that arthritis progressed, his hip joint was able to actually start to slowly sublux or dislocate and come out of the socket. That had made his arthritis significantly worse, and it also had resulted in some significant length changes in his leg, to where his leg was unable to reach the ground whenever he was standing to walk, even with putting his toe on the ground. So afterwards, what we were able to do is remove the broken pieces of bone as well as the arthritic femoral head and create a new hip joint for him.
So yesterday around 2 p.m. was my surgery, and I am up and walking today. Less than 24 hours, I am walking without pain. So I think that's a blessing. This is like a dream come true. You know, I've always dreamed of this. I mean, it's been years.
I came in just at the right time when the physical therapists were standing him off the bed. And I can just see the shock, the surprise, almost like a baby who's walking and taking steps for the first time in their life. I saw the look in his face, the smile, the disbelief almost that he was able to stand on both legs upright. And I can see that this light has been lit again inside of Karif, and I can see that gift that we have given him here in Fort Worth is something that he can carry on with him.
I felt like crying, still feel like crying right now, but this will be tears of joy. So yeah, it's amazing. And I just wanted to say thanks for this opportunity. It's a blessing.
Working for Treasure Tours have been a great factor in Karif getting this, by meeting the doctors, taking the doctors around each day to the clinic, and then by doing that, Karif get to meet the doctors and they saw the need and they start to help. This clinic is changed our life completely.
Well, just as how my son Karif needed help, I think there are others in the area who will benefit from this clinic, and you would see people waiting for the year to come around when those doctors visit.
If we have a clinic here, I know you have so much good doctors that come here and who are willing and able to do the job that they want to do. It would change the whole Treasure Beach. It will change Jamaica.
Having another clinic would do so much justice to so many people.
We started Jake's 25 years ago. We now have over 150 employees. We're very proud of what we do and how Treasure Beach is evolving as a community tourism destination.
So, part of the difficulty we have in the area that our residents have is that there is no health facility that is within a 10-15 minute radius, which is what you would want as an ideal scenario, especially based on the size of the population.
What we would like to do now is to have a full-time clinic that would be good for locals, good for visitors, and that volunteers would come down on a full-time basis and rotate, working alongside with the Ministry of Health locally.
The idea is to have a full-service clinic developed where we can deal with a number of different specialities so that our residents, importantly, have somewhere to go when they fall ill.
Can you imagine a community with 3,500 people having their own clinic? Yeah? Can you imagine the love and care that we already have, how much that would add to it? You know, and then also for the benefit of the tourists who come here, if God forbid and something should happen, those tourists could just go around the corner and their health will be taken care of right off the top.
The population has seen a significant increase from the days when it was a sleepy fishing village to now. So there is a direct need. Our closest clinic now only really deals with maternity. right, and has very limited operating hours. And then outside of that, it's in our capital, which is Black River, which again, it's 45 minutes away, and as you can imagine, especially with an aging population, that length of time presents a significant difficulty when somebody is in need of care.
I'm Ken. This is my boat. This is my boat. Yeah. I just come from sea. A lot of time I go to sea and hook come through my hand, straight through the gill and everything, and I have to rush go to Black River and Mandeville to go get it cut out. So if we had a health clinic here, probably it would be better. I hope it could come here tomorrow morning. I hope so. It's really, really, really needed right here. You understand?
We want to build a medical facility. Our dream is to have a rotating team of doctors from other places be able to come in year-round and help man that clinic along with local doctors and nurses.
What we see as a strategy for better healthcare is to make primary healthcare, which is our health clinics, bring them closer to the people, provide them with more services so that the hospitals are really only for emergencies.
The goal is to treat people, medically, but it's also to create relationships between people.
What has developed, largely because of the relationships in the community, are a team of visiting doctors who journey down yearly to see the residents, have the residents set up shop right here in Treasure Beach and have the residents visit. In fact, 2 years ago I had the wonderful opportunity to meet some of those doctors and to speak to them and to see the take-up. And the take-up was amazing in terms of the numbers of people that were coming to visit out of the communities. But what I think we have recognized is that some of the persons, especially those who are older, who find it more difficult to travel the distance, literally wait for a yearly checkup when the doctors come, knowing that the doctors will come in around July.
It will be really, really helpful in the community because when the doctors them are here, it's helpful for we in the community, join community, out of the area. Once they heard about it, they are here.
All I want to do is say thank you to the many people that has actually helped in getting me help and who are currently working on getting this clinic to continue going and to create a permanent clinic here in Treasure Beach.
Everybody is excited when we hear about this clinic here, want to build in Treasure Beach. I'm elated, can't wait.
I know quite a few people right now just waiting for the next clinic session. Just waiting for the doctors to be here.